So, today I want to talk about an autoimmune disease that a lot of people, including rheumatologists, have actually never heard of. It's called Undifferentiated Connective Tissue Disorder, or UCTD. Now, UCTD is used to describe people who have symptoms and certain lab results that look like a systematic autoimmune disorder or like connective tissue disorder, but they don't have enough of those characteristics to meet the diagnosis for a well-defined connective tissue disorder. Now, before I get into some of the other issues, I thought I would explain exactly what connective tissue is. So connective tissue is basically the glue that supports and connects various parts of the body, including skin, cartilage, and other tissue in the joints and surrounding the heart and lungs and within the kidney and other organs. So basically, connective tissue is everything that keeps you together, everything that connects everything. Without it, you would probably be dead. So, having a connective tissue disorder means that your body is basically attacking the glue that holds it together. So, now, connective tissue disorder, undifferentiated connective tissue disorder is very painful to live with. It really does hurt a lot. It honestly at some points it can make it hard to breathe, because the mere act of your chest rising and falling as you breathe in and breathe out is almost excruciating. And yeah, there are medications that you can take for UCTD, such as corticosteroids, which help prevent your immune system from attacking healthy cells and suppressing inflammation. Other side effects of that can include mood swings, weight gain, high blood sugar, increased blood pressure, weakened bones, and cataracts. So basically, taking the corticosteroids have some relatively bad side effects. As far as I'm aware, I don't think I've actually taken a corticosteroid, but I've taken so many different medications at so many different points in my life that I'm not sure. There are the second option is anti-malarial drugs, which are basically drugs that treat malaria, and they have no idea why, but in some people it can help with the flare-ups of UCTD. The most common one that they give out is hydroxychloroquine or Plaquenil, and it can be used to treat mild hydroxychloroquine or Plaquenil can be used to treat mixed connective tissue disease or even undifferentiated connective tissue disease in order to prevent flare-ups. Now, me personally, I have been on hydroxychloroquine and I've also been on chloroquine. I did not handle them well. I stopped eating. I was incredibly almost bipolar. I could go from being super excited, happy, to, oh my gosh, I just want to throw something at something, break something. And I was always tired. Going out in the sun, I would spend 2 seconds outside in the sun, and I'd be ready to go to bed, dead tired. Okay, so the third type of medication that could be prescribed would be calcium channel blockers, which are medications such as, oh, I'm so gonna butcher this, so please excuse me on this. Nefidipine, or Procardia, and amlodipine, or Norvax, which help to relax the muscles in the walls of your blood vessels, and can also be used to treat Raynaud's phenomenon, which can cause gangrene and which can lead to necrosis, and is often unrecognized with, let's see, okay, I have never actually taken any calcium channel blockers, so I have no advice on that. Another thing you could do is taking other types of immunosuppressants. So your doctor might prescribe other medication based on your specific signs and symptoms. For example, if they're similar to those of lupus, your doctor might recommend medications typically prescribed for people with lupus. Now, the problem with immunosuppressants is that it completely suppresses your immune system, since your immune system is what's attacking you. And so if you suppress that, you have no immune system. I did take some forms of immunosuppressants. The only one I can actually think of at the moment, though, is meloxicam, which that will have to be a whole nother video to explain everything I went through with that. But when I was taking it, I would get sick at the drop of a hat. I had no immune system, so anytime I was around any sort of disease or sickness, I would get sick and stay sick for a very long time. It got to the point where whenever someone would come over to the house, they would be sprayed with disinfectant spray before they were allowed to actually come in. And I would still get sick and I'd be out of commission for weeks. A simple cold would, well, it was near about, it was almost like I had pneumonia when I just had a simple cold. I could not get better. So with immunosuppressants, you really do have to be careful, because you will get sick. There's no helping that. Another type of medication, the fifth type, would be pulmonary hypertension medications, such as Bocetan, also known as Trilacir, or you could also be prescribed Sindifil, which also goes by Ruvanto or Viagra. And yeah, I know, a lot of you are going to be like, I thought they gave Viagra to people who had erectile dysfunction. Well, It's a pulmonary hypertension medication, so it helps with blood flow. I'm not really sure how it would help with this because I'm pretty sure it increases blood flow. So that would mean that your immune system is moving faster, I think. All those little white blood cells going around attacking everything are just moving around faster, attacking everything faster. So I have no idea on that one. So there are a lot of complications when it comes to having UCTD. In fact, 25% of the people who have UCTD end up in the hospital for special surgery. Caucasians tend to be affected more. Let's see. The disease tends to peak at middle age. Women are about 10 times more likely. Other people say that women make up 80% of the population with UCTD. So there are upwards of 23.5 million people who have this disease. Tends to also affect women who are of childbearing age, people with a family history, people who have live in certain environments with a lot of sunlight, who are around a lot of different types of solvents, or have like viral bacterial infections. It can cause lupus or scleroderma symptoms. Pulmonary hypertension is the main cause of death in people who have UCTD. There's also risk of lung disease, scarring and breathing issues. Heart disease can be caused enlarged or inflamed. The death rate is about 20%. A fourth of the patients have kidney problems, such as kidney failure or digestive tract damage. And 75% of patients are iron deficient and have anemia. It's often unrecognized, but up to 2.5% have hearing loss. So when it comes to living with UCTD, the only way to really get on the right track is to fix your gut, keep out the common fatty type foods, add nutrients. Fish oil is very good, having vitamins C and D, probiotics, regular exercise, and trying to find natural, just natural ways to live your life without I don't know, overdoing it, because it sucks. It's a horrible way to live. It will completely take over your life and decide what you can and cannot do. And it is terrifying, because they actually don't know how many people exactly how many people have it, because it often gets misdiagnosed. It was misdiagnosed in me. When I was 15, I was told that it was juvenile rheumatoid arthritis. And then I was told when I was 21 that it was most likely lupus. And then at 22, I'm told, oh, no, sorry, it's none of those things. You don't have enough markers for it, so we're going to put you into this catch-all category of undifferentiated connective tissue disorder. So it is very debilitating. I have a handicap parking placard, and I have multiple tools to help me open jars. I have a hairbrush with a bigger handle. I am on medication for pain. I have a humidifier, I have an AC, I have a heater, I have just so many things, like a giant bottle of Germ-X, special lotions I have to use because it affects my skin. Like, I don't know if you can tell, but there's a bunch of bumps here, and this is red, partially because of a sunburn, but partially because of the disease. And it sucks. I can't spend a lot of time outside because I get sick in the sun. It makes things worse. I actually like being outside. I used to spend all my time outside, but now I can barely go outside for more than 30 minutes without starting to feel kind of bad, feeling kind of sick. I can't stand for long periods of time without pain. I can't sit for long periods of time without pain. And sometimes the pain is so bad that it actually wakes me up at night. There are times when I just want to curl in a ball and cry. There are times when I absolutely hate life. It isn't fun. It's not pretty. It involves a lot of needles and blood work, and ending up going to the pharmacy so much that people know who you are and get your medicine out on the counter before you even get up to it. And the medicine combinations can be really bad, really taxing to the body. I remember having to call the pharmacy once when I was like about 18 or 19 to see if I could eat citrus fruits, such as oranges or grapefruits, because some medications you can't have citrus on because of the acid. I distinctly remember the pharmacist looking through the computer at my files and hearing her, I'm on the phone with her, and I hear her go, oh my God, just at the sheer list of medications. So I'm actually going to make videos talking about the different medications and the side effects I had on them. If you do want to know more about UCTD, you could very easily go to the Mayo Clinic website. It has a lot of information that you can find, and might make a little more sense than the way I describe it. But if you have a lot of muscle pain and weakness and your joints are stiff and you just haven't been told anything by doctors, ask them if maybe it's this. Because even if it sucks, it's a lot better to have a name for what's causing you pain than to just have pain and no way to describe it. No name for it. So even if it is a catch-22, it's a name. It's better than I had for a long time. So I am going to end the video here. Like I said, I will make more videos about the medications I take and the side effects I had. So until then, bye.